Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine living a lifetime condensed into just a few decades. All the health challenges, the physical changes we associate with getting older, but arriving way too soon.
Yeah, that's pretty much the reality for people with a rare genetic condition called Werner syndrome. It's often described as like an accelerated aging disease.
Exactly. It brings on issues we normally think of for much later in life, but hitting people in their 30s and 40s.
And, precisely because it mirrors so many aspects of typical aging, understanding Werner syndrome isn't just crucial for those affected. It actually gives us some profound insights into the basic biology of aging for all of us.
Absolutely. So today on the Deep Dive, we're taking a closer look at Werner syndrome, and we're doing it through the lens of some really fascinating new research.
Right. Our source today is a scientific paper, pretty recent, published in the journal Aging Cell.
And this paper's a big deal, right? Because it details the first clinical trial testing a potential therapy specifically for people with Werner syndrome.
That's exactly it. And, if you want the headline finding, this potential therapy showed some genuinely promising results for some of the toughest problems that people with this syndrome face.
Okay, so that's our mission for this dive. We need to unpack this study. We'll explore what Werner syndrome actually is, understand the science behind this potential treatment, look at the trial itself, see what the results really showed.
And crucially, figure out what this could mean, both for the people living with the condition and maybe, just maybe, what it tells us about aging more broadly.
Right. Let's start with the basics then. What exactly is Werner syndrome, based on what this source tells us?
Okay, so the paper describes it as a rare inherited condition, the root cause. It's changes or mutations in one specific gene. That gene is called WRN.
WRN. Okay, so that gene's the problem. What's it normally supposed to do in the body?
Well, the WRN gene is involved in some really fundamental stuff happening inside our cells. Things like copying DNA, repairing DNA when it gets damaged, and also maintaining the protective ends of our chromosomes, the telomeres.
Ah, okay. Critical maintenance jobs. So when that gene is faulty,
those maintenance systems get disrupted. And that disruption at the cellular level, well, that's what leads to the physical symptoms.
And how does that manifest? What do people actually experience?
You see features that look like accelerated aging. The source lists several key signs, often short stature, unusually low body weight, reduced muscle mass, that's called sarcopenia, and less fat under the skin.
Right, and the skin itself changes too.
Yeah, it tends to become tight and thin, sort of atrophic.
Yeah.
And as you mentioned from reading the paper, the foot problems can be really severe. Persistent calluses and these incredibly stubborn skin ulcers that just won't heal.
Yeah, those ulcers sound particularly debilitating.
They really are. And these aren't just, minor issues. They lead to serious, sometimes life-threatening complications. Those chronic skin ulcers we mentioned, various cancers hitting at a young age, and tragically, premature death. The paper notes the average is often before age 60.
That's just incredibly tough. And the paper really highlights that right now there's no specific cure, no fundamental treatment. It's mostly about managing symptoms.
Exactly. Supportive care. But often it's not very effective against how the disease progresses.
Which brings us to the biology and maybe a potential way to intervene. The source points towards a key molecule, right?
Yeah.
Nicotinamide adenine dinucleotide.
Yes. Nicotinamide adenine dinucleotide, spelled NAD+.
NAD+, okay.
NAD+ is absolutely vital. It's in every living cell, essential for, making energy from our food, and really critically for repairing damaged DNA.
And the connection here is that people with Werner syndrome, they have lower levels of this crucial NAD+.
They do. And this shortage, this depletion, is thought to be a key reason why the disease features develop and progress so rapidly.
Okay, so why does NAD+ get depleted? What's the mechanism the paper describes?
Well, it seems to stem from that faulty WRN gene and the resulting DNA damage. All that damage basically puts the cell's repair systems into overdrive. Specifically, it leads to excessive activation of an enzyme called poly-ADP ribose polymerase 1.
Poly-ADP ribose polymerase 1.
Yeah.
Or PARP1 for short.
Exactly, PARP1. Now, PARP1 is part of the DNA repair crew, but here's the catch. It uses up NAD+ to do its job.
Ah, I see.
So in Werner syndrome, with all this constant DNA damage needing repair, PARP1 is working overtime, and it's just burning through the NAD+ supplies way faster than the cell can make more.
And the faulty WRN gene might also mess with making NAD+ in the first place.
That's also thought to be involved, yeah. So it's potentially hitting both supply and demand, a real double whammy for NAD+ levels.
Like a perfect storm inside the cell.
Pretty much. And this whole understanding led researchers to think, well, what if we could boost NAD+ levels? Could that help counteract some of these problems?
Right. And there was some earlier work suggesting this might work.
Yeah, the paper mentions previous studies, but in model organisms, things like worms and fruit flies that were engineered to have Werner syndrome-like features. In those studies, boosting NAD+ actually improved mitochondrial function, the cell's powerhouses, and even extended lifespan or delayed some of those aging signs.
Okay, so that preclinical work looked promising, which leads us directly to the therapy they tested in this human trial.
Right. The compound they used is called nicotinamide riboside.
Nicotinamide riboside, that's NR.
NR, yes. It's actually a form of vitamin B3. And it works as a precursor, basically. The body can take NR and use it to make its own NAD+.
Is it found naturally anywhere?
Yeah, in trace amounts, things like milk and yeast.
And NR itself has been looked at before, hasn't it? We know it can raise NAD+ levels safely in healthy people.
That's right. And other research, mostly in animal models, though, has suggested potential benefits for other conditions. Things linked to aging or DNA repair issues like maybe neurodegenerative diseases or even heart failure models. It's also been linked to reducing inflammation.
Okay, so the logic seems solid. NAD+ is low in Werner syndrome. We think we know why. That PARP1 connection. Boosting NAD+ helped in models. And NR is a known NAD+ precursor. Testing it in patients makes sense.
It was definitely the logical next step.
So let's talk about this specific clinical trial. What was its main goal?
Well, this paper reports on the very first clinical trial designed specifically to check the safety, first and foremost, and also to explore the effectiveness of nicotinamide riboside, NR, in people diagnosed with Werner syndrome.
And they used quite a rigorous study design, didn't they? Double-blind, randomized, crossover, placebo-controlled. That sounds complicated. Can you maybe break that down for us?
Sure, let's take it piece by piece. Double-blind is crucial. It means neither the participants nor the researchers knew who was getting the active NR and who was getting the placebo, which looked identical but had no active ingredient.
Right, that avoids bias. People's expectations can influence things.
Exactly. Randomized means people were assigned to start on either NR or placebo purely by chance. Helps make the groups comparable at the start.
Okay, and crossover. That sounds important for a rare disease study.
It is. Crossover means after a set time, 26 weeks in this case, the groups switched. If you started on NR, you then switched to placebo for another 26 weeks. If you started on placebo, you switched to NR.
Ah, so basically every participant got to be their own control. They experienced both the treatment and the placebo period.
Precisely, which is really valuable when you have a small number of participants, like you often do with rare diseases. And placebo control just means you have that comparison point NR versus the inactive placebo.
Makes a lot of sense. How much NR were they taking?
The dose was 1,000 milligrams taken once a day, or the equivalent placebo.
And how many people were actually in the trial?
They initially enrolled 11 patients, and the main analysis in the paper is based on 9 participants who completed enough of the study.
And what were these participants like? What was their health status generally?
The average age was about 47, roughly half were male. And as you'd expect with Werner syndrome, they had common related issues, things like high blood pressure, dyslipidemia, which is basically unhealthy cholesterol or fat levels,
Right.
and diabetes. Some also had those really difficult skin ulcers we talked about. And importantly, all of them had genetically confirmed mutations in that WRN gene.
Okay, so the diagnosis was confirmed. Now the big question, what did the study actually find? Let's start with safety, always the top priority.
Absolutely. And the main safety finding was good news. The study reported no serious adverse events linked to taking nicotinamide riboside.
That's really encouraging for a potential new approach.
It is. They did note some mild side effects happened during both the NR and the placebo phases. Interestingly, maybe slightly more often during the placebo phase, according to their data.
Huh, okay. Any specific things they monitored?
Yes, they did observe a tendency for liver enzyme levels to increase slightly during NR treatment. Specifically, aspartate aminotransferase and alanine aminotransferase.
Okay, so AST and ALT. You sometimes hear about those with medications. Was it a serious concern?
Well, the paper makes it clear that none of the participants actually developed symptoms of liver problems, and the levels, while slightly increased, stayed well below what you typically see in actual liver disease. It's something they noted, maybe more in female patients, but it wasn't seen as a major safety issue in this trial.
Got it. Anything else on the safety side?
There was one instance where a patient developed a kidney mass, but this happened after they finished the NR phase while they were on placebo. The mass wasn't there at the start, and the researchers felt it was likely related to the underlying Werner syndrome itself, not the NR treatment.
Okay, so overall, NR seemed safe and well tolerated in this group over that 26-week period. Did it actually do what it was supposed to do, boost NAD+?
Yes, it absolutely did. The measurements confirmed that taking NR significantly increased the levels of both NR itself and, crucially, NAD+ in the participants' blood plasma.
Great. So the biological target was hit. Now, the really exciting part, did boosting NAD+ actually help with any of the Werner syndrome symptoms or problems? What about arterial stiffness? That's a big one, right?
It is, and this was one of the standout findings. The study reported that arterial stiffness, they measured it using something called the cardiovascular index, showed a statistically significant improvement when people were taking NR compared to when they were taking the placebo.
Cardiovascular index,
Right.
CAVI. So what does that CAVI measure actually tell us?
It's basically a measure of how stiff or elastic your arteries are. Less stiff is better, generally. And the paper points out that this CAVI measurement is independent of blood pressure. So the improvement wasn't just because NR lowered blood pressure, it suggests a direct positive effect on the arteries themselves.
Wow, okay, that sounds really significant for cardiovascular risk in this group. They also measured the ankle brachial index, ABI. How did that look?
Yeah, the ankle brachial index, ABI, that compares blood pressure in your ankle to your arm, often used to check for blockages in leg arteries, that actually showed a small decrease with NR.
Oh, a decrease. Is that bad?
Well, a decrease can sometimes suggest worsening, but the paper notes the change was very small, less than 0.15, and changes that small usually aren't considered clinically meaningful. So the CAVI finding on stiffness seems like the stronger, more positive vascular signal here.
Okay, so the arterial stiffness improvement is key. What about those awful skin ulcers?
This was another really compelling finding. There were 3 patients in the analysis who had these ulcers, and for them, the size of their ulcers significantly decreased during the time they were taking NR.
And compared to placebo?
Compared to the placebo phase, where the ulcer size actually tended to increase.
Wow, reducing the size of those ulcers that are known to be so hard to heal? That must make a massive difference in daily life. That's very tangible.
Absolutely. A very practical potential benefit.
The paper also mentioned possible kidney benefits.
It did. Some interesting signals there suggesting NR might be protective for the kidneys. They looked at the estimated glomerular filtration rate, that's eGFR, a standard measure of kidney function.
eGFR, right.
And the rate of decline in eGFR seemed to be slower during the NR phase compared to the placebo phase.
Okay, so maybe slowing down kidney function decline.
Potentially. And the metabolome analysis, that big picture look at small molecules in the blood, seemed to support this. Blood creatinine, another common kidney function marker, that decreased significantly with NR. And levels of some other molecules that have been linked to kidney issues in other research also went down. Things like 3-indoxyl sulfuric acid, N-acetylcholine, and phenol sulfate.
Okay, those names are a mouthful. 3-indoxyl sulfuric acid, N-acetylcholine, phenol sulfate. But the takeaway is less of these potentially problematic kidney-related molecules.
That seems to be the suggestion, yeah. That maybe NR helps the kidneys handle or clear these substances better.
Did that metabolome analysis show anything else interesting?
A few things. As you'd expect, molecules involved in actually making NAD+ went up. Interestingly, another pathway, tryptophan metabolism, seemed to be suppressed, and they saw an increase in spermidine.
Spermidine, that rings a bell. Isn't that linked to anti-aging research sometime?
It is, yeah. So seeing spermidine levels increase was quite an intriguing side finding.
Any other metabolite changes worth noting?
Well, one other molecule called N1-methylpyridone 5-carboxamide also increased.
N1-methylpyridone 5-carboxamide.
Yeah.
It's called 4-PY.
Good idea. 4-PY. Now, this increase has been seen in other NR studies too, so it wasn't unexpected. But the paper notes it because some other research has linked higher levels of 4-PY to potential cardiovascular risk. So it's just a reminder that when you tweak metabolism, there can be complex effects.
Right. It's never just one simple change. Okay, so we have stiffness, ulcers, kidney signals. What about general physical function, like strength or walking?
For the group as a whole, they didn't find statistically significant changes in things like grip strength or walking speed or standard blood tests like cholesterol or glucose.
Okay.
But there were a couple of interesting trends that didn't quite reach statistical significance in this small group, like the thinning of the heel pad, which is common in Werner syndrome, seemed to slow down on one side. And there was a tendency for visceral fat, that's the fat around your organs, to decrease.
So hints of other potential effects, but need more data to be sure?
Exactly. Those might be worth looking at more closely in bigger studies.
Okay, let's try and pull the main positive findings together then.
Okay.
NR definitely boosted NAD plus levels.
Confirmed.
It significantly improved arterial stiffness measured by CAVI.
Big one.
It meaningfully reduced the size of those really difficult skin ulcers for the patients who had them.
Very important finding.
And there were signals, both from EGFR and the metabolome, suggesting potential benefits for kidney function.
Right. Those are the key takeaways on efficacy. And what's really striking is that these improvements, arterial stiffness, skin ulcers, kidney function, these address major debilitating problems in Werner syndrome that are really hard to manage currently.
Yeah, it hits right at some of the core issues. And it really seems to support that initial hypothesis, doesn't it? That targeting NAD plus depletion could actually be a valid therapeutic approach here.
It certainly strengthens that idea. And, the implications might even stretch beyond Werner syndrome.
How so?
Well, the paper points out that NAD plus depletion and that overactive PARP1 enzyme, they're not unique to Werner syndrome. You see similar issues in other rare DNA repair disorders and potentially even in some more common neurodegenerative diseases like maybe Alzheimer's or Parkinson's.
Oh, okay. So findings in this rare disease context might offer clues for other conditions where similar mechanisms are at play.
It's possible. It suggests that maybe boosting NAD plus with something like NR could be worth investigating in those areas too.
That's fascinating. But as always with research, especially early stage trials, we have to talk about limitations, right?
Absolutely. And the authors are very clear about this in the paper. The biggest limitation, really, is the small number of participants, 9 people in the main analysis. It's just not enough to draw really firm conclusions. The results are promising, yes, but they need confirmation.
Right. Statistical power is limited with small numbers. Any other limitations mentioned?
Yeah, a few others. It was a single-center study, which can sometimes limit generalizability. The study period also overlapped with the COVID-19 pandemic, which, could have potentially impacted things.
Sure.
They also noted that a couple of participants who were assigned to the placebo group had to drop out because of complications typical of Werner syndrome itself, like infections or cancer. That can sometimes skew results slightly.
And you mentioned the crossover design.
Right.
Did they have a washout period between switching from NR to placebo or vice versa?
No, they didn't include a washout period. The paper argues that NR is probably cleared from the body quickly enough that carryover effects are likely minimal, but ideally, future larger trials would probably include one, just to be absolutely sure.
Okay. And one more, they measured NAD plus in blood, not tissues.
Right. They measured it in plasma, and they acknowledged that levels inside specific tissues might tell a different story, but getting tissue samples regularly is much more invasive, and the methods aren't really standard for clinical trials yet, so blood plasma was the practical choice.
Well, fair points to keep in mind. So, given these promising but preliminary findings and the limitations, what's next? Where does the research go from here?
Well, the authors wrap up by saying these findings are definitely promising and justify more research. The clear next step is larger studies involving more patients, probably across multiple centers, to really confirm these benefits and get a better handle on the effects.
And maybe look at different doses or longer treatment times.
Exactly. Future studies could explore those possibilities too.
So it sounds like this study is a really important, hopeful first step, but definitely not the end of the story for NR and Werner syndrome.
Precisely. It's opened a very important door, but there's more work needed to walk through it.
This whole deep dive leaves me with a pretty provocative thought, something I want to leave you, our listener, to mull over. We keep saying Werner syndrome is like accelerated aging because it shares so many features with normal aging. The stiff arteries, the inflammation, skin changes, kidney decline.
The biological parallels are certainly there, yeah.
So if this study suggests that targeting NAD plus metabolism with NR might help with some severe complications in this rare rapid aging syndrome, could that maybe offer clues or even treatments down the line for the rest of us, for the broader aging population?
You mean, could supporting NAD plus pathways help with common age-related issues like arterial stiffness or maybe chronic inflammation, or that gradual kidney decline that many people experience as they get older, even without a specific syndrome?
Exactly. Could insights from studying these extreme aging conditions actually teach us something fundamental about mitigating normal aging? What questions does this raise for you about the biology of how we all age?
It definitely makes you wonder, doesn't it? How much of what we think of as just normal aging is actually driven by specific pathways like NAD plus metabolism that might be modifiable?
It's fascinating to think about. Well, to wrap up, this study really does offer a significant glimmer of hope for people with Werner syndrome. It suggests nicotinamide riboside might help tackle some really tough complications like arterial stiffness and those awful skin ulcers, and maybe even support kidney function.
It's a concrete step forward, providing real data in the search for therapies that could make a difference for people living with this very challenging condition.
Thank you for joining us on this deep dive into some truly compelling research. Research on a rare disease, but with potential insights that reach much further. As always, keep learning, keep asking questions about the complex science shaping our understanding of health, disease, and aging itself.
Absolutely. There's always more to uncover.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.